Okay, in this video, I'm going to talk about meniscus tears and specifically trimming part of the meniscus out. It's one of the most common operations in orthopedics. Now, this patient is an upper 20-year-old recreational basketball player. Now, if you look at his knee, this first photo shows the articular cartilage of the patella or the kneecap and the trochlear groove. It looks nice and smooth, just like it should. Now, if you look at the inside or the medial side of the knee, you start to see the tear of the meniscus, the C-shaped shock absorber. Here I have a probe on it, and I'm showing the extensive nature of the tear. That's not a repairable meniscus. Now, you know it's torn because it looks different than here in the front of the meniscus where it's nice and smooth. It looks just like it should. Again, another photo of the posterior horn toward the back of his knee. Now, here's a probe pulling on his ACL, shows it's nice and firm, so he doesn't have an ACL tear. And then photos of the outside or the lateral side of his knee showing the meniscus intact, the articular cartilage looking good. There's nothing to be done on the lateral side of his knee. Now, as we go back to the medial side of the knee, look back at the meniscus tear. This is the type that needs to be trimmed out. So what you'll see in this upcoming video is me using scissors and a shaver, and that's what I'm doing here, using scissors to trim it back to a stable rim. Now, you take just enough meniscus that there's not part of it that's still left in place that could propagate and become a bigger tear, but then you also take, just as little as you can to prevent the development of arthritis changes down the road. Now, this is a fairly extensive tear that goes into the substance of the meniscus. It had a radial component and then a little bit of a horizontal cleavage component. That is, by definition, not the type that is repairable. And there's a number of different reasons and qualities that make certain tears repairable, and I've written about that a number of times on my blog, but this is not one of those. This one would not have healed if I had tried to put stitches in it and try to sew it back together. It needed the inner part of the meniscus trimmed out, and that's what you see me doing here. Now, you see all that debris floating around. Now I'm taking a shaver and getting rid of all that debris with suction, and I'm also using that shaver to smooth it back, smooth the remnant of the meniscus back to stable meniscal tissue. You want to taper it as much as you can so, again, that it doesn't propagate and form a new tear, but you do try to leave as much in there as you can to serve as a shock absorber going forward. He's getting back to recreation basketball. He plays just about every day, so we need to preserve as much meniscus as possible. Now, that, again, is the before photo. Now you contrast that to the after photo. That's what his meniscus looked like at the end of the case. Now, it still takes time to get him back to 100%, but he should be a lot better off than he was before. So if you like this, remember, definitely check out my blog. I talk about injuries and surgeries like this, health and wellness information, injuries and sports, you name it. Very active in social media, so follow me on Twitter or go to my Facebook fan page. Like to communicate with you guys there as well. And definitely check out my podcast, The Dr. David Geyer Show. I talk about hot topics in sports medicine, injuries and famous athletes, and I answer your question. So thanks for joining us.